Working in a urology clinic over the past year, I've dealt with many things. I've seen patients being diagnosed with bladder cancer, as well as I've dealt with the occasional kidney stone. Something I deal with on a daily basis is hearing my patients be diagnosed with prostate cancer. I understand how this is firsthand, as when I was 12 years old, my grandfather was diagnosed with prostate cancer. When I was 16 years old, my grandfather lost his battle with prostate cancer. Working with patients who suffer from prostate cancer gives me an idea of what my grandfather went through and the experiences that he went through when being treated. The process patients endure when being diagnosed with prostate cancer can be easily described as traumatic. Treatment consists of constant doctor appointments and chemotherapy, and the negative side effects that come along with these can be significantly damaging to a patient. The first step of being diagnosed with prostate cancer is probably the most difficult for patients and their families. This consists of blood work and a prostate biopsy. Initially, a patient is referred into the clinic due to elevated PSA. Then he's seen by the provider and his results are discussed. Once the results are discussed, this will prompt the provider to order a prostate biopsy if needed. Once the biopsy is ordered, the medical assistant will enter the room and schedule the patient for 2 separate appointments. One appointment being for the procedure itself and the other being for a follow-up a week later to discuss the results. The medical assistant will then inform the patient of their pre-care. The medical assistant will inform the patient of what medications to discontinue prior to the appointment, what time to arrive, and to cleanse their colon to relieve any discomfort during the procedure. Once the procedure's date arrives, the patient will arrive an hour early and be treated with oral and injectable antibiotics. The patient will be directed to lay on their left hip in the fetal position with their right hip exposed. Then the medical assistant will inject an antibiotic into the right deltoid muscle and as well as administer the oral antibiotic to the patient. The patient will be directed to wait out in the waiting area until the time of the appointment. Once the appointment time has arrived, the patient will be brought back and informed to be undressed from the waist down, lay in the fetal position on their left hip. Then the patient will be covered with a cloth and the provider will come into the room and begin the procedure. The provider will then insert an ultrasound probe into the patient's rectum and use ultrasonic waves to visualize the prostate. The provider will then insert a lidocaine into the inject a lidocaine into the prostate to numb the area for the patient. The provider will then take a biopsy gun and insert it through a needle guide into the biopsy probe, inject it into the prostate, and will catch samples of the prostate. The medical assistant will grab those samples and put them onto a cloth and input them into a pathology container and send those off to pathology. Once those have been sent off to pathology, the patient will return a week later for the results to be read to the patient. Once the results are read, this will determine for the provider if the patient is positive for cancer or negative for cancer. If the patient is positive for cancer, he will refer him to radiation oncology and then send him as well as to the University of Washington of Medicine for further treatment. This will begin the patient's long treatment for prostate cancer.